1,000 users who are getting benefited from this platform. Yeah, our endeavor is to reach thousands of hospitals in the next couple of years, and we request you to join in that journey, and we are passionately working in that direction. Our vision is also to enable the healthcare deliver better outcome by spreading knowledge through technology, and we want you to be a part of that journey too. I also request you to join our free COVID-19 Resource Center. All this information is available on our website. You can visit our website, ipchealth.in, and you will find a lot of free online courses on COVID-19. This is our third webinar. So all this webinar which we are doing, you can find those there. As on date, more than 10,000 users have been benefited from them, and I'm sure you'll find it benefiting to you as well. Now, before wasting much of our time, I would now hand over back to Mr. Vinay to introduce Dr. Suresh and take the webinar forward. Vinay, over to you.
Thank you very much, Varun. Ladies and gentlemen, it's a great privilege and honor to kind of present our doctor for today's webinar. It's none other than Dr. Suresh Badama. I don't think he needs an introduction for all of us who are in the medical field, who are associated with the healthcare industry at all. He's a professor and the head of Telemedicine Center, head of Forensic Psychiatry Unit, and consultant for community psychiatry. He's affiliated with the Department of Psychiatry at NIMHANS. He's also the president of Telemedicine Society of India for the Karnataka branch. He is also a visiting faculty at National Law School, Bangalore, for the State Human Rights Commission and Karnataka Judicial Academy, Bangalore. And it's very nice to know that he's also edited 3 books and has to his credit more than 270 scientific articles published in index journals. Recipient of the Professor Raghuram's Distinguished Young Teachers Award and Dr. C.V. Raman's Young Scientist Award. Dr. Suresh Badama, I welcome you on behalf of IPC Health. Thank you so much for taking time out from your busy schedule for this session that we are all looking forward to. I hand over the presentation to you to take it forward. Welcome once again.
Thank you very much. Can you allow me to share my slides, please? Vinay, can you enable the slides? Yeah, thank you very much. So, Vinay, can you give me the feedback whether you're able to see the slides?
Yes, Dr. Suresh, we can see the slides. Now it is in the slideshow mode. Yes, you may please proceed. I think the first, yeah.
Yeah, thank you very much, Vinay, and also the IPC Health for organizing this webinar. With all your permission, I'll be removing my mask, so it's slightly uncomfortable. So anyhow, this is a stress management. We will take it forward. So first, it has the whole presentation has 5 parts. So in these 5 parts, I'll be taking one after the other so that you'll be understanding the stress and then how to, what we call it as decode the stress and how it affects your health. And then finally, we will go for the stress management. Moving forward, see, first and the foremost, you should know what does it mean stress? What is the definition of stress? And everybody has a different way of understanding stress. If you ask a married man, what is your stress? He may say my family, my wife, or my children, or the economic reasons. Or else if you ask a married woman, she may say that I have to take care of my house and also the work. So she will give various examples of stress. But what do you mean by stress? So there are various people have defined across the world. So, but there are only 2 or 3 have been well accepted across. And first and the foremost being Huxley, he is basically the father of who coined the term stress. And as per his definition it's a non-specific response to any demand. Okay, it's like, for example, there is an earthquake or else like pandemic. So there is a non-specific demand to the body. But however, there is another person after some time, Lazarus came and said that it is nothing to do with the stress per se. It is the perception of the stress. That means, for example, Mr. A and Mr. B. Mr. A takes 1 lakh rupees loan and Mr. B has taken only 500 rupees loan. So Mr. B thinks if I go in front of Mr. Vinay, he may ask his 500 rupees. What will happen if he asks 500 rupees in front of everyone? And he's worried. But at the same time, Mr. A, who has taken 1 lakh rupees, is least bothered. He's searching for other people to get loan. So there are two people, A and B. One is worried about 500 rupees loan. Another person, Mr. A, who is not at all bothered about even 1 lakh rupees loan, he's still searching where I will get the loan. So again, the perception of the event which matters most rather than the stress itself. So these are the two commonest examples which have been discussed in the what we call it as definition of stress. So either you can consider as one is there is a demand everywhere like pandemic. So Hensley's definition holds good. The other one is there is a issue, but however one person becomes excessively worried, other person doesn't become excessively worried. So there is both issues. One is as an environment which causes stress. The other one is internal environment as a body myself, how I react to the environment. That also causes stress. So there are two important points for definition of stress. One is outside and the other one is inside. The next question is, okay, sir, we have defined stress. Stress is nothing but excessive demand, or the way I think and the way I perceive an event causes stress. So do we require stress? That is the question we usually ask to everyone. So just think for a moment. Do you require stress? You are a healthcare professional. Do you require? But unfortunately, it is an inevitable part of life. If you are born, the certainty is one day you are going to die. Similarly, the stress, once you are born, the stress invariably will be part of life. We should learn to deal the stress. So, for example, a child who is not studying, as soon as the exams comes nearby, they'll start opening the book and they start studying. If you look at the performance on the x-axis and the stress, basically y-axis, as the stress increases, as the exam comes near, the performance starts increasing. One exam, he will do well. Second, third. Similarly, as the stress increases phenomenally, his performance starts coming down. It's like a parabola curve. So we have to find a place, an optimal stress for an optimal performance. Each person has this optimal performance at optimal stress. You can't say that without stress, the life will be good. No, there will be no, what we call it as innovation. If there is a demand, the innovation comes. If there is no demand, nobody is bothered. So stress is inevitable part of life. Every day there will be stress. How you deal, that is called as eustress. How you feel distress, it is a distress. So the whole presentation today will discuss how the eustress can be increased and distress can be decreased. So that is how we are going to deal the situation. One more best example to understand this curve is, for example, Mr. Raj, who is married, he got a promotion during pandemic. He is very happy. So what he does is he'll go home and he says, I've invited something around 10 of my friends for dinner. His wife say, excellent, we will do a party. So they may do a party. 10 people she's able to cook. She used to cook only for 5 people. Now she has cooked for 10. After some days, he may say that I have got one more promotion. I'm going to bring 25 people. The wife will be angry. She says, you have to get something for me, then only I will cook. So negotiation, all those things happens. With the difficulty, with some help, she will be able to achieve and cook for 25 people. Now, Mr. Raj has got a big company. Now he is going to open a big company. And he says, you have to cook for 100 people. Now the wife says, nothing doing. I'm going to go back to my dad's place. You deal with your own colleagues. And she walks away. So that means her performance came down dramatically. The reason being is the stress phenomenally increased. So as the performance increases with the stress, but at certain tip off, that person gives up. So we have to find in each organization, it may be health, it may be a software industry, the optimal stress for each person, and it differs from individual to individual. So stress is, this slide clearly says that the stress is inevitable part of life. So what are the different types of stress? It can be failed romance. Most common in India is failed romance. That is basically interpersonal relationship or problem in the family, death, serious illness, failure in exams, especially in children. So most of us as parents, we feel that children do not have stress. Sorry to say that. The child at the age of 6, 7 have committed suicide. The reason being is stress. So the stress of parents will invariably transmit it to kids also. So the way you deal pandemic, that will be seen by your children and they will also learn from you. If you are cool, calm under the pandemic, the child will learn from you because parents are the mirror for the kids. So if you are able to learn to deal with the stress, child also will learn from you. Coming to what are the effect of stress, especially in healthcare? The most common is burnout. Can we compare this burnout with our COVID stress? Slightly different, because burnout it's a result of ongoing stress without resolution. Similar to pandemic, but it is different because pandemic it's not just a stress, it is a survival now. Survival, if I get an infection, I may die. That is the equation where it starts. So the burnout syndrome plus emotional burnout, where if we add in COVID, gives a different paradigm. In this pandemic of what we call it as not only it's a COVID pandemic, it's a stress pandemic also. Now coming to the workplace stress, what are the commonest stress during this COVID? In the past 5 to 6 months, we are at Nimans, we are doing stress management and also looking after our own employees at Nimans. We have found that various reasons for stress. Commonest is fear of contracting COVID infection. I may get infection. Though I may not be the frontline warrior, I may get infection. That is the first commonest stress. Though many of them may say no problem, but still that is the first commonest fear. Next one is fear of transmitting infection to family members. That is children, wife, father, mother, friends and colleagues. It's not only just the fear of transmitting. The problem is once by chance you get positive, the guilt of transmitting to colleagues, friends and family, that guilt is the biggest problem especially in healthcare, because we have been taught to cure, not to transmit disease. The pandemic has changed. You can be a super transmitter. So that's the problem here, the guilt that I may transmit infection. That is the second one. Third, fear of dying. I may die alone. I'll be admitted in the COVID ward and I may deteriorate and nobody will be there next to me when I die. That fear of dying alone is one of the biggest threat, not only here in the general public. This is the commonest what we see here is whenever there is a COVID positive is there, the earlier the hospital used to call them and say, you have been turned positive. That person either used to commit suicide or used to run away from that place. That is the reason the hospital stopped giving the reports to the person, because they may respond or react in a different way. So, but later the protocols are changing. Next one is fear of losing loved ones because of the COVID. Stigma and discrimination from society. You ask many of our nursing staff, they say, if I become positive, what will my neighbors say? What will my apartment people will say? The most commonest earlier part was non-availability of this protective gears, either N95 mask. So these are the biggest worry earlier part. And the next question which my colleagues, my friends and my team members used to say is, sir, I would like to work 24/7, but is there any safe place to go? Because I don't want to go home with the COVID and transmit to my dad or mom. So this is one of the commonest question which used to happen. Is there any, if by chance, if I have been quarantined or isolation, is there any plan? Is there any support to me or my family members? That is the commonest. If I am isolated, imagine, suppose you are getting isolated, what will happen to your kids or your parents? So that's the biggest worry they had. Inadequate training. Many of them did not know what to do. The protocols and SOPs are changing. Today there is one protocol, tomorrow is not there. Similarly, World Health Organization started with telling that you should not wear mask. Mask is useless in the earlier part. But now mask is mandatory and it is part of many legislation. So SOPs are changing so fast. Today morning there is one SOP, evening that changes. Accurate information of COVID is not available. Even if it is available, the media comes up with different information which causes more stress to us. And the other issue is communication at workplace, because the SOPs has changed, and where the PP has to be worn, where the PP has to be discarded, and suddenly they may say, we have got something else, you have to use this. So the communication becomes the biggest headache here. So if the communication is good, half of the problem is solved. Workload. Again, increase in workload. And there was earlier part when SOP came in telling that above age of 55 need not come to work. So that created a trouble because majority of the seniors started going on for leave. Once seniors are going on leave, the morale of the youngsters was questionable. The next another issue, which was what we call it as managing the emotions of the COVID patients. Imagine if you have bought a COVID patient, he's crying or she's crying, I have left my kid at home. Or the elder person says that, leave me, I want to die. It's already, I'm 80. Why are you trying to treat me? So those managing the emotions of those elderly or the emotions of COVID positive patients, they may be angry. Why are you quarantining me? So that anger, dealing with them is very difficult because you'll be wearing PPE. They will not be able to see you. At the maximum, they can see your eyes. They don't know who is behind the mask. So those kinds of managing emotions of the patients, if you're not trained, it will become a big headache. Violence by the patients and the family members, because you have seen various places. And the other issue is, you are also a human being, your pre-existing health status. You may be having hypertension, diabetes, or maybe some other heart problems. So that itself causes more stress. That is at the workplace. Home front, there will be a different set of stress, which can be support from the family members. I've seen many of our, what we call it as contract staffs who have been, family said that, why are you going to work for just maybe 15,000 or 12,000? You take resign. So many of these women who are working here in our hospital or various hospital, they will resign. Once they resign, the remaining workforce has to provide the care. That increases. And day-to-day related issues at home, that will be another biggest problem. Or else, if a woman is a nurse who is coming to the hospital, the husband may not be cooperative. You may say either you apply leave or resign the job. This may be the other issue. Or if a lady is pregnant, the husband may not allow her to go to work also. So there are various issues at the home front. It starts happening. Managing children at home. You ask a working nurse how she is managing at home, and also COVID, and also going back home with the fear of that I may have contracted COVID. It will be very difficult to understand. The next question is cost of treatment if I get COVID. Please do understand, it's not if I get. Definitely the day, tomorrow, or maybe next month down the line, everybody has to face it. So if you get, invariably your family will be exposed. COVID does not touch individual, it touches the whole family. That's the biggest problem. Now the question is, have you made a plan? If you get positive, what are the plans? Do you have pulse oximeter at home? Do you have BP operators? Do you have enough of medication? Do you have made a plan? Did you discuss with your family members? So that planning is very essential. Many a time you want to discuss, your husband or your wife may say, why are you unnecessarily discussing this? You're not going to get COVID. Sorry, now you have to plan. You have to have a plan. If I get COVID, what are the phone numbers? Who are the helping people? Where I'm going to get quarantined? Where the children will be looked after? Who is going to look after? If there is a money required, who is going to lend the money? Who is going to operate your bank account? Suppose you are the only earning member. By chance, you are COVID positive. By chance, your family member is positive. You are inside in isolation or in a quarantine. You may not be able to go and help them. Who is going to help your family members? Because I have seen my own friends, they got positive. The whole family is under stress now. He is sitting in the room. He has to make 100 calls to admit his family member because beds were not available recently. So that you have to have a plan. If you don't plan, sorry to say that, you will have a severe stress. Plan it thinking that if I get no, when I get. So thinking pattern has to change. If I get no, when I get COVID positive, what are the things I'm going to plan? Now coming to the physiology of stress, these are the definition, and there is inevitable part of stress. Now moving to the physiology. Coming to the physiology, as soon as you see or pursue a stress, it may be fighting with your husband or your colleague or your boyfriend, or you're worried about studying or a death, exams. Once you pursue the brain, the hypothalamus and pituitary, ACTH, adenocorticotropic releasing hormone releases, and suddenly once you see the stress, the whole endocrine system gets activated. As soon as activated, it sends a message to your adrenal glands. At the same time, sympathetic system is on high alert. What does it mean? Whenever there is a stress, the 3 F's gets activated. Those 3 are either freeze, suddenly you froze, freeze basically. Fear, okay? Free, and then fly away from that place. So either the 3 F will happen. For example, you are walking on the road, suddenly the BMTC bus or the transportation bus or a lorry comes and applies brake, and the brake is working, and the vehicle stops around half a feet away from you. What will happen to you? You will be frozen, you will be shaking, you'll have tremors. The driver will come outside and say, could you find another vehicle to die? Why are you coming in front of my vehicle? And you don't know what to do. You are frozen there. Somebody has to pull you from that place. You will have panic attacks. You will have increased breathing. You will have increased heartbeat. The reason is the body is preparing now at that time. That is basically the heart rate increases so that the blood supply to the muscle goes there, so that either you run away from that place or you start fighting, or you are a frozen man at that time. So all these is basically survival instinct. So that the stress is given, there is a stress, you survive by increasing the heartbeat, increasing respiration, which increases oxygen supply to the various part of the body, and also it increases the glucose availability to the muscles. So this stress response, by releasing cortisol and epinephrine and all other hormones, increases your body, preparing it for the fight. This is the commonest one stress response. Imagine if the stress continues like pandemic, daily if there is a stress, imagine what happens. What is this adrenaline? Adrenaline is nothing but a hormone. What kind of hormone? It is a glycoprotein. The glycoprotein, where did it come from? It came from the cell. Which part of the cell? The mRNA gave information that it has to release adrenaline. What is this mRNA? mRNA is nothing but which the information came from DNA. So it's a genetic. So these genes gets expressed whenever there is a hostile environment. What are those hostile environment? One is there is infection everywhere. You have to protect yourself. So that is one. Suppose you go outside, it's very cold. It's maybe 0 degree. Your body starts shivering. The reason being is the body releases more than 350 different type of hormones to protect you from that environment. So this is basically, there is an environment, there is a genetic expression now. So these genes are expressed during hostile environment. If the hostile environment continues, the gene expression continues. These gene expression causes what we call it as, if it is very small stress, it comes out, the body will not have a severe impact. If the stress like pandemic continues for more than 1 year or 6 months to 1 year, your body will definitely have different impacts. Those we will discuss now. So the whole endocrine system gets involved. The whole endocrine system, you can see from hypothalamus, pituitary gland, thyroid, pancreas, adrenal gland, ovary, name the gland. All those glands are involved during stress. So it means the whole body gets under tremendous stress. That means if it is very short duration, it's very protective. If it is very long duration, it will be damaging to the body. There was a study done by JAMA recently, and then it is in this year only, when they looked into the healthcare workers' stress and what are the different types of response. And it was not a small number, 1,257 people were studied or they were interviewed. They found that out of 1,250, 50% of the healthcare workers had depressive symptoms. 45 had anxiety symptoms, and 34 had sleep disturbance. Distress, they were very distressed about various issues, around 72%. That means you're not alone. The whole health fraternity are going through a stress. That basically means it is a normal reaction to abnormal situation. It happens to me, it will happen to you also. That means this is an abnormal situation, and we are giving, our body is responding to this abnormal situation like lockdown, pandemic infection, people are dying and people are recovering. So this, please understand, it's a normal reaction to abnormal situation. And I will discuss what is normal reaction and what is the abnormal reaction in the coming slides. Please understand, first and the foremost, you should also learn to recognize the symptoms of stress or signs of stress. There are 5 different types of what we call it as symptoms. First is somatic symptoms, emotional symptoms, behavioral symptoms, cognitive is thinking basically, and biological symptoms. We will talk about somatic symptoms. Somatic is basically the way our body responds to stress. Majority, if there is a severe workload or a huge work, then you will have headache, some of them have backache, some of them have body ache, some of them have chest pain, some of them have severe fatigue, joint pain, gastritis. These are all what we call it as physical symptoms of stress. So that is one. Coming to emotional symptoms, if there is a workload is very heavy, obviously there will be anxiety, there will be panic attacks, there will be low mood, there will be depressive symptoms, becoming numb. If there is too much of work or suddenly there is a death in the family, the person becomes numb. Numbness means he doesn't know what is happening around him. Sometimes frustration, anger, these are all emotional symptoms. Third one is behavioral symptoms, becoming hostile, hitting somebody, becoming isolated, avoiding people, becoming withdrawn, crying, substance use, internet addiction, suicidal behavior. So these are all behavioral symptoms. Cognitive symptoms, basically it's a cognitive thinking process, becoming confused, unable to take decision, poor attention and concentration, poor memory, unable to judge, difficulty in thinking process. The commonest is memory problem. Biological symptoms, basically sleep problem, not having appetite, decreased libido, altered bowel and bladder movements. So these are the commonest biological symptoms. To recapitalize, the 5 domains are there: somatic, emotional, behavioral, cognitive, and biological. It will be in various combination, or else one person may be only somatic. Women most of the time will be emotional in nature, and the thinkers will be having more cognitive symptoms. So it depends upon the combination the person will react. So how to identify that I am stressed? Because I'm a health worker, no, I can't be stressed out. So the problem is, most of us are denial is the biggest problem. So how do you identify? You have to ask yourself certain questions. Simple questions are, do you get tired easily? You get fatigued easily? Earlier you used to work for 8 hours. No, I'm very, what we call it as energetic. Now if you work for 2 hours, you become tired. That is what we are talking about, easily tired. Becoming irritated, becoming sad very fast for trivial reasons, and fear to go to work. You're afraid to go to work. You're avoiding, you're applying leave for not going to work and unable to concentrate in work. Forgetting easily. You have to give medicine to one patient, you may forget and give the medicine to another patient. These are commonest signs of stress. And easily becoming what we call it as infectious. Infection immunity will be less because of the cortisol level is very high, and difficulty in falling asleep. You have worked very hard, you go back to sleep, you can't sleep till 3 o'clock. Whether your appetite is normal, suddenly you start increase in alcohol intake, tobacco intake, various drugs you start using, or else you start, our healthcare workers are well known, they start using alprazolam. That is the biggest problem. And suddenly there will be loss of interest. You don't find interest in watching the serials which you liked earlier. Now you say, no, I don't want to watch. Or you become angry with the children, or you lost interest even in sex. So all these indicates there are some stress. Coming to the effect of stress on health, it affects every part of the body. Headache, body ache, I discussed. Infection is very common because cortisol levels are very high because adrenal gland started pumping in cortisol. Now you are seeing many doctors and nurses dying because of MI, because of increased stress. The same other person who is also working, but he is able to manage his stress, he doesn't have. Because of continuous stress, imagine, the BP increases. Suddenly, you are finding many people are diabetic now. Again, this is because of stress. Why did it come? Because of the stress, genetic, what we call it as is expression is occurring now. Arthritis, accidents are becoming common now. Common accidents are like you are taking the needle and you are giving injection. Either the needle may break or you may give wrong injection to wrong person. So these accidents are increasing. Or you are driving the vehicle and you may pass, you may go away, you have to stop, you have to take a turn for the 5th cross. But you are just thinking you may go to the 7th cross and realize, oh, my house is behind. So you go back. So these kinds of accidents, depression, post-traumatic stress disorder, adjustment disorder, hair loss. This is again increased during this pandemic. Acne. People who did not had acne, now they started getting sexual dysfunction, accidents which I have been told, and the alcohol use, gastritis, frequent infection, anxiety disorder, somatization, acute stress reaction. So these are the commonest effect of stress. The other commonest problem is stress can worsen the pre-existing illness. You had psoriasis, stress will worsen. If you had diabetes, stress will make it uncontrolled. If you have BP, that is basically if you have hypertension, it becomes more. So any illness, it becomes difficult to control. That means you require more medication, more dosage is required. Relapse of pre-existing, if you had an illness like depression around 5 years back, it may relapse now. Or you had multiple sclerosis around 5 years back or 10 years back, it will relapse now. So that means relapse of old illness is very common here. And in vulnerable population, the illness can be precipitated. For example, your dad has had diabetes, you may have diabetes during this pandemic. Coming to the other effect of stress, it will affect all parts of the body, brain, heart, blood vessels, endocrine and kidney, GI. Name the part of the body, it gets affected. Aging becomes very fast during stress. Coming to the stress management now, till now we discussed about various aspects of stress. Now we will be going directly to the management of stress. Stress management has 3 components, especially for our healthcare workers. One at the community level, second one at the hospital level, third is the individual level. Coming to understand, please do remember, the stress, you're a part of a community. You're a part of an hospital or a society. And yourself. What you can control, what is under your control, please do remember that. Many times doctors are worried, what is happening to this nation? There are leaders, they will think about the nation. You have to think about yourself, that is self, about your hospital and the community. So you should know your domain. If you know your domain, it is easy to deal with stress. If you don't know, you're thinking everything. Oh, what is going to happen to this country? Oh, people are dying. You will get more and more stress. So please understand, self, that means you have control over yourself. You may have, to some extent, control over the family. Very little control over the hospital. The community, you can't control. So only thing you can do at the community level is advocacy. Hospital level, you can have some amount of what we call it as discussion. Self, you can change. Now I will spend some time on community, hospital, and self. Coming to the stress management at the community level. First and the foremost, like many doctors or many people who are there in the healthcare industry knows that they can do some advocacy, they can talk to people, making sure that the stigma of the healthcare workers and the family decreases, of the healthcare workers of the family members. Because earlier part, many places, if the nurse family or the doctor's family, they were not allowed to enter into the apartments. And next is the community should follow the advice of the doctors or the nurse, or the healthcare workers. Make all efforts that the violence do not occur against the healthcare workers. That is basically the community I'm talking. Okay. Priority access to day-to-day general essentials, like some of the platforms are giving. If you are mentioned you are a doctor or a nurse, see, some of the platforms are making so that the daily whatever requirements from the general stores are made available to your house. Insurance for healthcare workers. Many a time the doctors or the nurses or the other healthcare workers, what we call it as clinical workers, are worried, if I die, who will take care of my children or my wife? So that's the health insurance is very essential. Especially in the private, it's the biggest problem. Investing in public healthcare by the government, that is very essential, because earlier, before the pandemic, it is hardly 1.25% GDP was spent on health. Now it is time, and now it is very clear the pandemic has told you have to change your expenditure towards the health. Similarly, forget about the government. We, as a doctor, as a nurse, we are ready to take our car to the maintenance. And if they bill 5,000 to 10,000, we are least bothered. We pay and come back. Suppose you go to the hospital and the doctor or somebody says, you have to do these investigation. You being a doctor or a nurse, you'll ask, why should I get this done? That means you're ready to spend for your car, not for yourself. So that is our thinking process. That is the biggest problem. So we have to change our thinking process. So investing not only, if you change, the public will change. The public changes means the government will change and invest in public health. And other important point is we have to tell the public to limit their social media exposure, because social media exposure tells you only death. It will not talk about the life, or what we call it as people who are coming out of the COVID infection, coming at the hospital level. Each hospital, suppose if you are the hospital chief, you are watching this presentation, you have to be an excellent leader. You have to lead from the front. You should not say that you go and work and you're sitting in the chamber. It should not happen. You should lead from the front. The hospitals which are doing amazingly well are those hospitals where the chief of the hospital is leading in from the front, not from behind. The leader should stand front, even if it is pandemic. So that is very essential. Having adequate security personnel, because in this pandemic, there will be some clashes, fights between the patient and the healthcare workers. So you being the leader, you have to make sure that the adequate security personnel are available. Training your staff. If there is a new equipment, because we have come to know that the government has brought huge amount of ventilators. Many people do not know how to use it. That becomes the biggest headache. You have brought various equipments to provide care, or there are maybe new equipments have been donated to your hospital. Many people do not know how to use it. And you tell them use it without training how they can do it. And start having daily debriefing with all the team members. That's very, very essential. You are sitting in an ivory tower in the top of the hospital building and you don't know what is happening at the, what we call it as the low level, then it is a biggest problem. You should be able to talk to the D group worker, or what we call it as a cleaning staff of your hospital. Ask him what is their concern. Talk to them. Once you talk to them, see how the hospital moves and it starts functioning effectively. Awarding the best worker of each week, doing that will also increase the morale. See, most of the time, many of our staff work for the pride, work for recognition. That has to be done. And also important thing is you have to, if you are changing the protocol, you should not just send a protocol. The protocol should be, if you're giving a new protocol or sending a new SOPs to the hospital, it has to be accompanied by having a meeting with various heads of the departments or the sections. It need not be in person. It has to be, it can be virtual meeting. Then only the SOPs gets implemented. Otherwise, the communication will be a biggest problem. And start discussing what are the accommodation facilities if our staff gets positive. If the staff's family members gets positive, how much you are going to support them. Communication is the key. Where there is a movie, they say that entertainment, entertainment, entertainment. Similarly, in our hospital premises, communication, communication, communication. For keeping the staff moving safely. At the same time, not to have legal problems means documentation, documentation, documentation. So these communication and documentation are the pillar of healthcare industry. So after talking about the community, hospital, now we're coming to the last part of it is individual. You can't change the country. Yes, it's not possible immediately. You can change the hospital to some extent. Now at the individual, how can you care for yourself? How you are able to take care of yourself during the stress? So in this process, there are two things of managing as you yourself. One is as a stress management. Another one is resilience. So there are two important things here. Stress is managing the stress. Resilience is growing in the stress. That means there is a problem like SLC exam or second PU exam or MBBS exam or a nursing exam. Okay, you're managing it. That's one. You are taking the exam, passing it. You have got one more degree. That is resilience. You are able to face the problem. You are able to face the stress and you are growing it. So I was, as soon as I joined my job in Nimans in 2004, I got an offer to work in Tsunami. I volunteered to go to work in Tsunami. I was posted in Andaman Nicobar. I worked for nearly 4 to 5 months there. During that time, I understood resilience means what? Resilience means good family support and relative support. Having a good network of support is very essential. Good social network. Having a network of friends need not be in person. Virtual network is also good. Religion belief or spiritual belief. Having an altruistic leader, amazing leader if you have in your apartment or in your hospital place, and dependence on materialistic need is very less. If you are able to have these kinds of things, the various studies have said resilience will increase. This I was able to see in Nicobari and various other, what we call it as tribal part of the Andaman Nicobar. Example I will give you. In Nicobari's families, the families are huge. The families are maybe from 70 to 120 members are there in the family. And during tsunami, especially in Car Nicobar Island, there was a huge number of deaths, maybe 40 to 50,000 people died. Do you know the whole family out of 120, 60, 70 were survived? See, the whole family it's a whole clan, if you ask me. The head of the family is called as a captain. So there, the whole family used to support each other. A person has died. He has 2 kids. Somebody immediately within the family adopted them. And they started within a matter of time, they built their own temple and church and they started religious work. They did not dependent on the government. So they, within a matter of 1 month, they are on their feet, they are working. We call them as tribal. Okay. But there are civilized people who have gone from the mainland India to Car Nicobar Island to work. They are under stress. They are thinking the government has not given anything. Nobody is doing anything. They have depression. They have various problems because the family from the mainland India is hardly 3 or 4 people. And there is 1 person died, there is a huge vacuum in the family. Whereas in the Car Nicobar or the Nicobaris group, their family is well knit, there is highly supportive in nature. Their dependence on the materialistic need like having mobile phone, internet, electricity, nothing. They immediately built their huts. They moved from the shores to the higher place. They started living their life. They did not bother who survived or who did not survive. The life continued and they were able to overcome the stress. And they actually be called as civilized. We are tribals actually. That's what I would like to say. And that time I realized how the resilience works. And the resilience is overcoming not only stress, growing from that stress. Now also you can see there are many people during pandemic, they are growing. Some of them are getting destroyed. So resilience is how well you are resilient, even under the stressful situation, you bounce back and stand taller. Coming to knowing that whether I am stressed, because in the stress management at the individual level, whether I am stressed, that is the first question. If you are able to answer that, half of your problems are solved. If you are in denial mode, many of our healthcare workers, including nurses and doctors, they are losing their hair. They don't know why. They are not able to understand even there is huge stress that is causing that. You talk to any dermatologist, first thing they will say is your stress is causing your hair loss. But you say, I don't have any stress. You sit with your friends or family members, start analyzing what are you thinking most of the time in a day? What are you worried about most of the day? So if you're acknowledging that I have a stress, what are those sources of stress? What are the effect of stress on me? If you are able to understand this and acknowledge it, things starts moving in the right direction. If you are denying, nothing can be done. So first is acknowledging and ask yourself what are the causes of stress. So once you know that you have stress and you have acknowledged it, things starts changing. Change your lifestyle. What are those lifestyle? Lifestyle is invariably during pandemic is haphazard lifestyle. You get up at whatever time you want. You go to work at different time. You have very lazy life or having different diet. So starting with exercise, diet, managing weight, adequate rest, decreasing in intake of alcohol and smoking, time management. So these all will form a part of lifestyle. Unfortunately, the doctors have a very poor lifestyle. They will give 100 reasons to say that I'm busy, I can't do exercise, but they will be telling for their clients or the patients. Nurses also same thing, oh, I have to go back. Can't you find half an hour for yourself? You may say, I'm leaving for the family. Excellent. Can't you find half an hour for yourself? If you are able to do that, your life changes. If you don't find half an hour for yourself, sorry to say that stress management is very difficult. You have to find 30 minutes for yourself. If you are able to find 30 minutes, you can start bringing in change. Change in what time you get up, how you're going to do exercise. Exercise means, sir, I'm doing from morning to night, I'm running around. That is not. That is a different exercise. Going for a walking alone, having your own space for thinking what I am doing, what is my reason for existence, how will I lead my life? Because this pandemic has changed the thinking process. Now it is how to survive. At the same time, what is the quality of survival is the issue. So making lifestyle changes is very essential. So first step in stress management is lifestyle modification, including your diet. If you are eating junk, the health breakdown will occur. And if you are eating something nonsense and you are tomorrow working and you are having PPE, your abdomen is upset, you want to change the PPE. That's the problem. So the whole process is like this. Coming to the important thing is, how do you cope with the stress? Please understand, there is in Bhutan, there is a saying, if you have a problem, okay, there are two things. There is a problem, okay, so there will be two possibilities. One, there is a solution to it, okay, you have a solution, work towards it. Second one, there is a problem, there is no solution. If there is no solution, why are you worrying? Because there is no solution. For example, if there is one of your family member or somebody has died, he has died, is there any solution for it? Learn to deal with your emotions. One is problem based, another one is emotion based. Problem based, there is a problem, find the solution, work towards it. There is no point in worrying. There is a problem, there is no solution for it. Start dealing with your emotions. That's what we call it as coping. Just avoiding the problem is not the answer. Many a time people will start avoiding. Why should I avoid? They will say, why should I take the problem? Let the problem come, then I will deal. Avoiding, that is one of the biggest problem. Second one is maladaptive behavior. What are those maladaptive behavior? Basically, they start drinking alcohol. There is a stress, they start smoking. Men start, there is a stress at workplace, come back and beat up wife, or they will beat the children, or else they do other kinds of behavior. So that maladaptive behavior will increase stress further. So if there is a problem, either it should be problem focused or oriented, you have to resolve, or learn to deal with the emotions. So these are the two important things you should learn. Coming to change in the lifestyle. What I said is, see, basically there is a stress in the middle. If you look at, there is a stress. You have an adaptive behavior, resolution of stress occurs. If there is a maladaptive behavior, that is drinking alcohol, smoking, fighting with your wife or other family members, that itself will become a stressful life. They start fighting with you. Or if you're drinking alcohol, that drinking alcohol itself will make you more stress. So coming back to this, changing life, first is acknowledging stress, changing lifestyle. That is the second. The second is, the important problem in this pandemic is uncertainty. When will this pandemic stop? When I will get infected? That is the problem. So don't think when I will get infected. I am going to get infected because you are a healthcare worker. This pandemic is not going to vanish like this. No, it's going to be here for some time. If I get infected, rather than thinking that, so one of the commonest ways, why me? Don't think like that. Try me. Let's have, if I get infected or when I get infected, what are the things I will do and how I will come out of it? So instead of thinking uncertainty, because uncertainty is the mother of frustration, if you ask me, and that will create a lot of trouble. So that part has to be clearly dealt easily and properly. And scheduling your day is very, very essential during this pandemic. Your family, your kids, they get up at 11 o'clock in the afternoon or 12 o'clock. You have to schedule their time as if the school is there. If you schedule their day, your stress from the children decreases. If you don't schedule their time, it will be a problem. They will get up at whatever time. In the middle of your work, they will ask food. They will ask different things and you become irritated. So daily routine, scheduling the day is very, very essential. Coming to other lifestyle, maybe if you are enjoying dancing, why not start dancing? Singing, no problem, without disturbing your neighbors. Music, listening to the music, drawing, painting, hobbies, writing. If you like browsing, please do that. It should be very limited period. Don't sit on the internet for 24/7. That is not the way to go ahead. And if you enjoy reading, why not? So you have your time for your dealing with stress. Of course, exercise, playing sports, participating in game. If the gym is open nowadays now, you start thinking of going gym, or you have your own gym at home. Need not go to the gym to weight dumbbells. There are various things you can modify. Nowadays, many of our doctors, my friends who are very good at gym, they have came up with the innovative way of doing workout at home rather than going to a gym. Walking, jogging, various things can be planned. The next very essential is sleep. Because majority of our doctors and healthcare workers have biggest problem is sleep. So maintaining regular sleep is that sleep cycle is very, very essential. And use bed only for sleeping. Don't use for bed start going and sleeping there and reading books, browsing. Don't use beds for other things. So don't do that. Avoid stimulant after 6 p.m. Don't have coffee, chai after 6 p.m. Because if you have, that decreases sleep. Stop watching horror movies and watching crime stories or crime diaries or Savdhan. Or you watching news, a simple news at prime 9 p.m. That they will create more problems. You will not be able to sleep. They will show horrible images. The majority of our media ethics have gone to that level down. They show children dying and say, oh, look at this, what is happening. Unfortunate. They show all suicidal behaviors or suicide, they glorify it. And that causes more stress to you. So avoid watching the mainstream media also, not only social media, mainstream media. Have time for it. Comfortable environment for bed. Have time slots for social media, please. Though it is in your mobile, switch off those, what we call it as Wi-Fi or data for some time. And also there is something called as autonomous sensory meridian response. This is coming up nowadays. Basically a simple massage from the neck to bottom of our body. It starts changing and it causes soothing. And there are various ways. Like simple example I can give you is if your mom is just patting your head, or if she's singing a song or what we call it as lullaby, the child goes to sleep. That is the best example I can give you. Or some light music can make you go to sleep. or else somebody's doing a light massage on your head can make you go to sleep. That is basically ASMR actually. You can go and read on the network, on the internet. Indoor games like badminton, carom, cards, chess, there are n numbers are there. Start interacting with your family. This is one opportunity the pandemic has given to spend time with your family members. Many of you are cursing. Before this pandemic, you did not have time for your family. Now you have some time for family. Why don't you spend that? Because there is working hours and then there will be off because of COVID duties. So sometimes you get those. If you have that luck, please utilize that for that purpose. Of course, various other things you can start doing. One another important thing which I found very, very useful, even in disaster, that is working in tsunami, and also in Uttarakhand flash floods. I was posted in Badrinath, Joshimath, and also in the Narayan Bagad of the Rudraprayag. I was working there. There I realized every evening talking to your team members, debriefing. Suppose today I was in OPD. When I go back home, I have to call all my team members over the maybe Zoom meeting or maybe Google Meet, talk to each other. How was the day? How was it? What are the new things you learned? Oh, this patient came. I was able to deal like this. I was wearing mask. I was wearing visor. So you discuss all those things, and it may be for 15, 20 minutes. And leader of the team, if he does it, it's excellent. Even I was doing debriefing for initial around 3 months for my team, asking what is their suggestion. I used to ask my junior resident and even the nursing team, sir, madam, what do you want to do? Is there anything change you want to do? How was today's day? If every person speaks around 3 minutes, they will be happiest, telling that our team is doing very well. That debriefing which occurs in military, immediately after every, what we call it as operation, there is a debriefing procedure. The debriefing procedure will make the thinking process different. That is what we call it as cognitive restructuring. A person, a nurse or a doctor may think, so I am going through a stress. When he's sitting with the team and discussing, every person had the problem and every person is dealing the stress in a different way. That debriefing gives him an opportunity to learn the skill from his peers. That's very, very important. So debriefing, please do. In your hospital, each team can have their debriefing virtually. If you are able to sit around in a big room with a physical distancing, wearing mask, fine. But virtual meet every evening or maybe every morning sometime, half an hour to 1 hour makes a difference. Or at least 2 days once, update to your senior. You talk to your senior. So that creates an environment of communication. That will decrease stress. Basically, sharing is caring. That's what I've seen nowadays, moms telling their kids, you have to share with your brother or sister. That's what sharing is caring all about. So here also you're sharing your problem with your team members. They may come up with a solution, one, or else they're listening to you. What more do you want? And you are able to understand, oh, I also went through this problem. So it is easy to share the problems and deal. There are hospitals where there is a chaos because communication is not there. There are hospitals, they are working very smoothly in spite of having COVID because their communication is too good. So ultimately, the communication, and if you are going through trouble, if you are going through, your family member has been found COVID positive, or you have been COVID positive, discuss with somebody, find a member, find a friend, find the social network which will support you if you are getting admitted or you have to be isolated. So that is very, very essential. Of course, food, please, home food is very essential. Not the packed food, the junk food. Because now I've realized the home food, the carrying food from home makes a lot of difference. Because once you wear PPE, 12 hours, if you have a good food, proper food, you will not have that bowel reflexes. Many of our doctors have that anxiety. And when they wear PPE, within 4 or 5 hours, their tummy upset will occur. They have to remove the PPE. And the seniors will say, why are you removing PPE? You may say that there is a nature call. Of course, there is a nature call. How can that be overcome? Having home food. Whenever you don't have home food or outside food or a canteen food, of course you will have problem when you wear PPE and do the duty. So this change in food habits, avoiding certain foods which your body doesn't suit. For example, for me, wheat doesn't suit. I should not have chapati. If I have chapati, I will have difficulty because I have to go for toilet 3-4 times. So you should know what you should eat. So if you know, because tomorrow I am going to have 2 days duty or what, 24 or 36 hours duty, you should know what to eat. Like for example, during travel, your mom may say, don't eat this food. She knows you better. So please listen to your mom. She is the best person. What fits to you, what doesn't fit to you, she knows very well. Though you may be a doctor in gastroenterology or you may be a doctor in various other things, but your mom will be knowing what food suits you. Coming to that, I told you, problem is there. If there is a solution, it is a problem focused. If there is no problem, there is learning for emotions. Coming to managing emotions, this is very essential. First and the foremost, whenever there is a stress, what is the emotion I get? Is it the anger? Is it the frustration? Is it the depression? That means recognizing your emotion is very essential. If you don't recognize your emotion, because men are poor at recognizing emotion. If a person is standing in front of you, you should be able to tell at least around 60% of the time, yes, this person has this emotion now. By looking at his face, by looking at his gesture, by looking at his words, what he speaks. That is identifying emotion on yourself and your colleague or your, maybe even your patients. So that's what we call it as managing emotion. Is first is identifying the emotions in yourself and other. That is very essential. Once you identify the emotion, it is easy to modulate. If you don't know who is the enemy, how will you deal the enemy? Similarly, what emotion is damaging you? Is it the frustration, anger, depression, or irritability? So once you know that I am having stress, because of stress, there is an emotional problem of irritability. My problem is irritability. Now I will deal the irritability. Yes, of course, stress is a problem. If there is a stress cannot be solved, like pandemic now, learn to deal the emotion. Okay, of course, you have to take protection from COVID, but at the same time, you have to deal the situation. At the same time, you have anxiety. You may have panic attacks. Many of our doctors, some of them became so anxious, they started washing for half an hour. They are like carrying whatever the hospital gave sanitizers in their pocket and running away. They may become very anxious. It is okay to not to be okay because there is an abnormal situation. So these are the normal response. Some people, every person reacts in a different way. Okay. But if it comes in your way of sleep, if it comes in your way of working, it comes in your way of social functioning, you require help. No, you have emotions, anxiety. After that, you're able to work. And once in a while, these emotions comes, no problem. That means you are able to deal with your emotions. No, sir, I have depression since past 2 months. You require help. I'll give an example. For example, there is a death in your family. It should not happen, but if it happens, or you have experienced death in your family, on that day, what will happen? Either you have a denial. How can you die? That the denial or shock will be there. After some time, you accept there is a death. You will have something called as smashan vairagya. That means, what is there in life? Why should I live? Everybody is going to die. So this kind of feeling will be there first day. You don't feel like eating. You'll be continuously crying. You don't want anything. You don't want to even look at your children. So that is common, first day. Second day, it will continue, but it decreases slightly. That smashan vairagya comes down. And fourth day, it decreases. Seventh day, you will have a good sleep. You will have food. Whenever you remember your person who has died, you will cry. On 11th day, there will be a ceremony. Or 9th day, or 13th day, there will be a ceremony, or sometimes 14th day, or what we call it as Vaikunta, or whatever the various ceremony. On that day, the relatives will come, usually I'm telling, not in COVID, when they come, you sit with them, you cry for 5 minutes, and you have food, and everybody walks away. Life continues. Okay, that is normal response. Okay, But imagine if there is a person, a family member has died, this person is not mingling with anyone. After 2 weeks, he's sitting alone. He's not crying. That means he's in a severe depression. He requires help. One is normal reaction, another one is pathological reaction. In the same death, a person cried for 3-4 days. He had a severe depressive symptoms, smashana vairagya kind of thing. And later he recovered in 2 weeks. In depression also same. If a person doesn't recover, has continuous feeling sadness like that vairagya, feeling like I should die, I should commit suicide, why I am alive, requires professional help. Please don't hesitate to contact psychiatrist. Please do that. So if you are worried, you talk to your friends and see whether it can be dealt, or talk to your physician. That is the very important part of understanding about emotion. Other things, how do you deal with severe, sir, I'm becoming irritable, I'm becoming angry with my kid. First and the foremost, accept you are becoming very angry. You are becoming frustrated. First you accept that. Next one is start whenever you feel that deep breathing. Go sit single in your room, start, have a deep breath and count 1, 2, 3, 4 and then start inhaling and think as if you are exhaling your anger, your frustration. If you are able to learn this deep breathing, that is what is yoga actually. That is meditation also. That is the way you are going to breathe. We are all breathing without our knowledge. Here it is, you are focusing on your breathing. What is doing is you are taking a fresh air and you feel that and just think that I am exhaling the anger outside. If you do this wherever, whenever you feel, if you are stressed out, sit for a moment, take a deep breath and start exhaling that I am exhaling all my stress and worries. That it is called as deep breathing. Meditation, start thinking about God. Or else if you don't want to think about God, think about good, whatever good memories what you have. That will decrease. Distancing from the anger provoking situation. If you know that your colleague provokes you anger, avoiding meeting them is one way. But at the same time, learn to deal that. For example, one of my friends used to irritate me to that level, I started avoiding him. But as I grow up, I had to meet him daily. Then I started thinking about, one is thinking about bad about him. Other one is thinking about good thing about him. Then I realized he is a head of the blood bank. During this pandemic, he started running around, getting plasma, doing various work. I realized he's an amazing guy. He may have problem with me, but he's a good person. You have changed your perspective about that person. Your anger start decreasing. That is the way to deal. Avoiding time out. Whenever you are feeling excessive emotional outburst, you have to time out, you have to take. Distraction is one. Listening to music, having prayers, humor, let go. Let go is another one which I'm going to discuss for a moment. But at the same time, I would like to see what is the time now. 4:20 already. We have crossed a lot of time, but still a couple of more slides are there. One of the important thing is let go is a very essential phenomena. Holding on to something for longer time will damage you, will hurt you. So you have to learn to let go. The let go is a phenomena which has been what we call it as mindfulness therapy. In this mindfulness therapy, what you do is you let go your emotions, or what we call it as a emotion which hurts you a lot. The best example I can give you is a monk is sitting on the rock and he has a lot of worries. Okay, worries about his family, which he has quit. He comes to know that his mother is suffering from cancer. So he doesn't know what to do. So one of the best way he learns, says the monk, he looks at the tree on the river bank and there is a leaf falling down. He will write in his mind that my mom is suffering from cancer. And he will allow the leaf to fall onto the river and it washes away. And he has let go on that emotion. Okay. Of course, the truth will be there, but let going the emotion. That means you are distancing yourself from that emotion. That is what called as let go. Because holding on to something will hurt you more. For example, somebody had hurt you very badly. He or she has criticized you very badly. holding on to that will hurt you more. Rather than forgive them, not for them, for yourself. If you forgive them, your hurt decreases. You will be able to carry on with your life. Otherwise, you will be hurt more. You will be thinking about him, how to take revenge. And it increases your, what we call it as emotional turmoil inside. Because Buddhism has an amazing, even Jainism also, they are steps, if you look at it, forgiveness stands at the top. So here also, let go is basically one of the emotions. Should learn to know those emotions and learning to let go those emotions. Coming to the other part, basically relaxing whenever the emotions is very high, and also taking nap whenever you are feeling frustrated. Relaxation, whatever relaxes you. It may be listening to music, having a coffee, or the best example I can give myself when I feel very tensed or stressed, I go sit and have a coffee and start doing breathing exercise when I'm having coffee. That 15 or 10 minutes gives me a very good reboot. Okay, so that will help you to recharge again. And also, one of the other important problem is compassion fatigue. That is basically the people or the patients under you start dying, or they have various problems, or your family member or your relative dies, or your compassion to feel towards the patient decreases. You become numb. That is again one of the indicator of emotional fatigue. And this is the difference between burnout and COVID burnout. COVID burnout is associated with compassion fatigue. After some time, you become numb. The people or the patients are coming to you, you don't feel anything to them, or even your family member, you don't feel it. This is an example of compassion fatigue. Many surgeons have this compassion fatigues. Many nurses who are working in ICU have this. That is called as compassion fatigue. How to deal with that? Talk to your superiors, talk to your mentors, talk to your teachers. They are the best way. They have the wisdom how to deal these problems, because these are not written in the books. These are the wisdom which is there in the minds and the experience of your seniors. So you may be an excellent teacher, excellent surgeon, excellent nurse, and you may be what we call it as a matron, but you require a good mentor. If you have a good mentor, you will be able to deal a lot of problems and you can overcome any stress. Thinking process, changing the thinking process. Just now I told why me instead of that try me is one of the simple example. There are various thinking problems we have. So that thinking process has to be changed. Suppose one doctor may think that all my patients should be cured. If I see 100 patients, all 100 patients should be cured. Is there any such doctor? No. There is death will be there depending upon the illness. We are here as a messenger to provide care, not cure. Cure is by nature. The care is our responsibility, our profession. Even legally speaking, it is the standard of care, not the standard of cure. That makes the difference of cognitive appraisal. Basically, there are various things are there. And coming back to this, one example I can give you about cognitive, how it impairs you. Imagine there is a child, or you may be when you are a child, you go to a function along with your dad and mom, okay? And in the function, your dad will introduce your brother as telling that he is an intelligent guy. He's very good. He's excellent in studies. And he will show you and say, this fellow is good for nothing, creates trouble every time. This child will think that I am useless. My dad doesn't love me. My father, mother doesn't love me. Although his dad is doing all his best to provide equal resources, the way he introduced the child to the society, the child will start thinking negative things. This is done without the knowledge of his dad. His dad is doing just simply without his knowledge. This will create a problem, what we call it a sibling rivalry. Over a period of time, they will end up in court as an adult, fighting that this property belongs to him or here. This cognitive belief that I am not cared, I am not loved, that starts from the family itself. That is the best example I can give you. The childhood events sometimes will be imprinted on you. Two sisters will fight. The elder sister will think that the mother or the father doesn't like me, and she had given 20 grams of gold in the younger sister's marriage, and I got only 5 grams. And they will be fighting whenever they meet on the Deepavali or Ganesha festival at home. This was a simple mistake by the parents, the way they introduce their kids to the society. So that belief that I am not cared for will run every time. Whenever your senior says, I will not give you leave, this whole process will start running. My parents did not like me, so nobody likes me. Nobody likes me means I'm useless. I'm useless means why should I leave? So that anger goes on building. So whenever there is a refusal, this whatever program which is done from in the brain will start triggering the problems. So you have to replace your maladaptive thoughts. Basically, if you want to learn cognitive behavioral therapy and you want to undergo this change in your behavior, it requires around 15 to 25 sessions has to be done with either a psychiatrist or a psychologist will do. It's a whole process. Many a time, your own kid will tell, you don't love me. There are various reasons for it. Either you have not given time to him. Whenever you came late, you have brought something to him. So your love is equated to some material. Maybe phone, maybe chocolate. You came late, you brought a chocolate. Now love for him is equivalent to chocolate. Whenever he wants something and you don't give him that, he feels that you don't love him because you have taught it. So that is the problem. So this thinking process has to be changed. It takes time. And the person has to accept, I have to change my thinking process. So there are various negative thoughts. And one of the other important things I would like to bring to your kind attention, that is, we call it as Zerneric effect. In this, the brain will be focusing only on unfinished tasks. Today, I would have done 8 tasks. Okay. I have not done 2 tasks. My brain will be focusing more on 2 tasks. That will create unhappiness. Though I am 80% successful for the day, I'll be saying, oh, 2 things I have not done, I'm useless. What a kind of person I am. That is what we call it as Zerneric effect. And it is again very common in healthcare professionals. Suppose you have done 10 operations, 9 of them did well, 1 something happened. You will start focusing on that 1 and you become disturbed and distressed, though 90% you did very well. So that is what is again very common in our health professionals. And you have seen 80 cases today. 1 person came and shouted at you. Yes, possible. 1 person did not like your treatment, the way you treated him. Possible. It happens with me. It happens with you also. You start focusing on that 70 instead of focusing on 79 good outcomes. You focus on that 1 case and you become disturbed. That is what we call it as unfinished task, or not getting good outcome will have a problem. So there is again various cognitive process. In COVID, what are the cognitive process you have to do? First and the foremost, you will have, I will die or my family will die. Sorry, change that thought process to 85% will have mild illness. Only 2 to 3% will die. This is, you are taking the whole COVID positive cases. As a general population, nobody knows at this point of time. But in COVID positive cases, 2 to 3% may die. That is the truth. And if you are in the age of 30, less than 30, it is 0.2% possibility of your dying. And if you are in the age group of 40 to 60, there is a different score. And if you are above 60 or 70, the percentage increases. So knowing the truth, the cognitive thought process has to be changed. My loved one will die. That will be another problem. Again, you have to think, okay, 85%, it will be mild fever and it will go off. Another 7 to 8% may require hospitalization. Last 4 to 5% may require intubation. Only 2 to 3%. That rewiring thinking repeatedly is important. Otherwise, you watch one news channel that will change your thinking process. And they say, everybody is dying. You go outside, you will die. That's wrong. So that you have to think about that and stop trusting social media, sensational news. They are more creating trouble rather than helping you, because social media, first time the pandemic, they have oversensitized the people. They have created more problem than helping people. But of course, it has sensitized, oversensitization, biggest problem. So staying away from the rumors. Don't forward unwanted or a rumors information to the public. The other problem with our doctors and nurses, only I can do. Sorry, only you can do. Remove that. I am a human. I can do this much. That you should have. I have to work more. No, you are a human being. You require rest. I have to work on Sunday. People are suffering. People are dying. Sorry, you can't prevent death. Death is inevitable for everyone. You can provide care. Please understand, you can provide care. The cure occurs because of his body, because of his immunity. The surgeon can bring two cut edges together. The healing occurs because of his body, not because of a surgeon or because of a doctor. It is the nature which cures. The doctor and nurse provides care. So I am responsible for infection. Sorry, it is a pandemic. Everybody gets infected. I am responsible for death. Sorry, in certain people, death is inevitable. You can't do anything. You will be just a spectator. Accept this. That is very essential, because moral injury is the biggest problem in doctors and nurses, especially in pediatric wards. So you should be learn to deal that. So please understand how to deal at the end of the day. What every day, put a diary. What was my contribution to the society? What did I do good to the family? What did I do good to the friends and parents? And what I did for myself. That itself will give you the worth of living. Okay? Coming to the problem solving and decision making. If there is a problem, I told you, there will be different solutions. Weigh each solution, pros and cons, take a decision. If you are finding difficulty, talk to your close friend and ask his suggestion and see whether they can help you. Or else talk to your seniors or talk to your grandfather, grandmother, dad and mom. They will provide solutions sometimes. This will be the better option. This will not be the better option. The best example I can give you is, if you want to buy a car, what will you do? What is the money I have? Which car is best? You will talk to your friends. You will go to the showroom. You will find internet. You will do search and you will talk to your wife. She will suggest some color. Finally, after 1 week, you will come to a conclusion to buy a car. And you will say, I will buy X car, this color, this model, diesel or petrol, hatchback or sedan. So that problem you solved it, taking help from all. So every problem requires help from all. You are not God. You require help from as a team. The health care is a teamwork, not one person's work. Coming to the time management, of course, the time management, if you go to YouTube, there are various videos are available. Because of time, again, we are running out of time. I am cutting down on the time. You should know there is a matrix, what is important, what has to be done immediately, whether I have to do it, can I delegate to somebody else? Unimportant work can be kept it for later. Important work can be delegated. So you should know how to deal those situations. You can't be present in every place, delegate the work, and which is important, you have to do, you do it. Coming to the assertiveness, learning to say no is very essential. Just because you have to say yes to everything, you will be at the receiving end. Sometimes you should learn to say no. So that is very essential. So assertiveness is very, very important. There is a difference between assertiveness and violating rights. Assertiveness is saying no if somebody is violating your rights. Becoming aggressive is violating somebody else's rights. Assertive is somebody is asking you to do his work every time. Once, second time, third time, sir, no, I have to go back home. That is assertiveness. So being assertive is very, very essential. Communication skills, at the end of the day, if you ask me, communication skill is the basic fundamental of healthcare industry, if you ask me. Not only healthcare industry, even in the hospitality industry. In the hospital, communication plays a role. We as a doctors and nurses has been taught to us for the outcome. No, the society looks at the process, not at the outcome. Please understand, it is the process what it makes. Even if you have got something wrong, like suppose you go to a shop and they have given the material and they spoke to you very nicely, even that the goods was damaged, you may feel, oh, that person has done something. You go back and the person talks to you nicely and replaces, your anger will not be there. So that means it is the communication, and the verbal and non-verbal communication matters most. Hobbies is very essential. Unfortunately, we have taught our children only to study. Sorry, there is hobbies. Please teach them hobbies. Hobbies increases self-esteem. That is very essential. So it may be singing, dancing, sports, anything. You should inculcate hobbies, not only for you, for all the family members. Spirituality. Please do understand. You ask any person who is dying, talk to him. He will give you the essence of life. That is what is very essential. It is not the car or the mobile phone or anything. The essence of life is the person who has limited period. Ask him what is life. If a person has been diagnosed as cancer, he is going to die. Ask him what is life. He will give you the moral of life or what is the goal of life. That is what is very essential. Spending time with family, spirituality, having faith in God, or maybe you may have faith in various things, need not be God. Okay? If you don't believe in all religion, go to a halfway home. Go to orphanage home, what is happening now. Go and see. Go to a mental retardation home or intellectual disability home and see how the kids are treated there. In what condition they are there in the pandemic. That will change your way of thinking towards life. Work-life balance. So this is again, it's very difficult now because working from home has become the norm. Unfortunately, work-life balance occurs in a different scenario. Now this, what we call it as work-life balance, again, you should know, even if you are working from home, when to switch off. Because work has entered not only your home, to your bedroom, even to the toilet. People are carrying their mobile phone, attending meetings through even their toilet. So you should learn to deal, because this work-life balance is becoming a difficult process. So you should learn when to switch off your phone. Family, friends, please keep in touch with your family, your friends. Spending time with your friends is very, very essential. It need not be in person. It can be in virtual. Spending time with family, I told you, it is not the quantity of time, it is the quality of time which matters. At the end of the day, you may see how much time I have spent with my daughter. She's getting married today. So that losing that time is and you can't get back that time. Coming to the individual level, finally, first and the foremost, you have to identify yourself, whether I'm having stress, monitor yourself, how the stress is having an effect on your body, maintaining routine schedule, lifestyle, updating your knowledge, contacting family members, debriefing with your team members, being aware of protocols and guidelines, discussing with your colleagues, accepting the loss of a patient, relaxation, yoga, meditation, spirituality, having faith in God takes you a long way to go. To conclude, please do understand stress is an inevitable part of life. This is normal people in an abnormal situation. Accept the challenge, because behind every challenge, there is an opportunity. Accept stress. Learn to deal with stress. And healthcare is a teamwork. So these are all the stress management I discussed, the same things. Please do understand. Saint Mother Teresa has said, it is mandatory for nuns. She had told for nuns. I am telling you, it is mandatory for every healthcare worker to take time out of their duties, to allow them for their injuries, moral injuries, okay, or ethical injury to have occurred, or you have lost your own patient or family member, so that the caregiver heals by himself. So taking time out is very, very essential. It is not, you are not committing a crime. So you should take often, maybe weekly once or twice, take off from your work. That is very, very essential. It is, I am not saying, even Mother Teresa has said this. So please, taking break, time out is very, very essential. So many of these videos are available in my YouTube channel. If you go to Suresh Badadmat, or if you want to connect with me, LinkedIn is available. Just type Suresh Badadmat, you'll be able to contact me. Thank you very much for your valuable time. These PPTs and this video will be available on YouTube for your kind consumption. And I'll be circulating this presentation also for the people, so that you, being a healthcare worker, you can do the stress management to other people. Thank you very much.
Thank you very much, Dr. Suresh. I think every aspect of managing this situation, I think you were able to cover. And I would not say it's limited only to healthcare professional, but I think to each one of us, I think it's applicable. Thank you so much for this valuable session. We have quite a few questions pouring in now. Some have emailed us earlier itself. And yes, we definitely would like to connect you on LinkedIn and on your YouTube channel too. If time permits, I'd definitely like to kind of take a couple of questions which has come in now from some of the participants without wasting much time. Do you think people who have, I'm sorry, do you think people who have recovered from COVID also face challenge coping when they join work? Your comment on that?
Yeah, of course, definitely. First and the foremost is my friend who is recovered just now, he wants to come back to work. He has his own thoughts, whether I completely recovered or not. Yeah. If I'm infected, though he knows he's already spent 14 days in quarantine, isolation, he has come out, still he has a doubt whether I'll infect again, whether I'll get infected again. So that moral, ethical dilemma, even being a doctor, he has this. And he also had this, did I infect anybody? Because I was his friend, I also had to undergo testing along with him. So he was worried whether my friends will get infected. And because of them, their family members. This guilt, carrying guilt, is a huge problem with our doctors and nurses. So this pandemic will hit everyone. It is irrespective of whether you are a doctor or a nurse or you are a healthcare worker. Any person can get infected depending upon whatever their risk involved. So even after the pandemic is over, or after the infection is over, isolated, there is a high possibility you may be reinfected, or else there is a possibility the lung fibrosis is occurring. Many people are having infection, continues to have some mild kinds of infection, immunity related problems in the brain, or it may be in the immune system. That will continue to have. Many people continue to still, now also they have difficulty in breathing sometimes. Earlier, one of my friend who had infection, he used to jog with me for nearly 5 kilometers. Now he can't jog more than 1 hour, 1 kilometer. So those kinds of ups and downs will be there. It takes time to recover from this COVID infection. Of course, one is physical problem and mental health problem go hand in hand. Yes, Vinay.
I would allow Anita Kumari, who's raised her digital hand, to ask a question. Anita, please go ahead and ask. While she takes times to unmute, I would ask the next question, which has come in on the email. Are there any support groups who are conducting counseling sessions for healthcare professionals or anything on the lines run by NIMHANS itself?
Okay, we are doing it for general population. There is a helpline available, and our doctors and psychology and psychiatric social work team, they're continuously giving help to the healthcare for the what we call it as general population. Healthcare worker, there is a discussion is there, but still we have not started for the healthcare workers because we are overwhelmed. In the earlier part, when our own healthcare workers, which started, we had around 75,000 call per day, and we had around 25 lines continuously running to provide care. So most probably in over a period of time, we may have to start this health, what we call it as helpline. In Bombay, one of the group has started, my couple of colleagues, even in West Bengal, Gautam Shah and his team. And in Bombay, I think Anjali Chabria and their group, they are providing care and they are supporting, even if they require ambulance for healthcare workers, they are doing it. In one of the IMA, actually, I think Tumkur or somewhere, they have started their own helpline, or what we call it as supporting the healthcare workers, having their own ambulance. A couple of hospitals, they have dedicated for only the healthcare workers. And in one of the place, I think in one of the city, I forgot is my friend, the anesthetist, what they did was they got a house rented. So after finishing their work, they are going to that house and staying rather than coming back to the home. So the healthcare as a group, if we are together, we will be able to deal with the stress easily.
And so, what's your advice on coping for healthcare workers who are working remotely, family in some other location? I think you did cover that aspect too.
Yeah, you see, there are two ways of looking at it. One is you're away from the family. That means one part of your thinking process, if I get infected, I'll infect my family, that process is not there. So it's a blessing in disguise in one way. Of course, if you get infected, you may also, out of 100, 97% nothing will happen to you. 3% what will happen to me, that thinking process will be there. This happened to one of the, because I do even stress management and also I teach at Karnataka Judicial Academy. One of the judge had this problem, telling that I have been posted in a remote place, sir, in one of the taluka place. I am away from the family. When I gave this perspective, you are alone. Yes, if you get infected, you are alone, you will be able to take care of yourself. And the thinking process changing is very essential now. It's a blessing in disguise, if you ask me. If I'm alone, I'll be able to deal, I will be able to work very, what we call it as without thinking back. Otherwise, now I'll be thinking, because every time I go to the short stay ward and the emergency, I will wear PPE every time, because I'm worried if I go back and if I infect my mom, who is elderly, what will happen to her? So I'm worried about that. So invariably, there is a phases of each situation. So every challenge has an opportunity. So your challenge has an opportunity. You are not going to infect your family. So that is the way to think and go ahead. Yes, Vinay.
So, Dr. Vijay Kumar, I think it's a comment. Is it possible to conduct same session to our healthcare workers from NIMHANS?
Why not, sir? Definitely. There are some requirements in NIMHANS. If you want me or my team to do it, you have to send a letter. Again, the letter should have that it is done free of cost and it is a part of a corporate social responsibility or free. We can do it. And this video will be available free of cost in the YouTube channel. That is, you type Suresh Badadmat. The same can be played even if I am not available. At their leisure time, they can see at home and learn the coping management. So this video will be not only available on my YouTube, even in this IPC Health Webcare, for they can undergo the training of this module and answer certain questions and get the certificate. If I'm right, Vinay Rao, is it right?
Yes, absolutely. And Dr. Suresh, we have one more question. For that, we'll be closing the session shortly. To all participants, feel free to type in your questions, or you can raise your digital hand. I can enable you to talk. Richa Patel would like to ask a question. Richa, please go ahead, unmute yourself.
Sure, thanks, Vinay. I just wanted to ask one question, which said that how can I help a colleague who I think is stressed out, but really not ready to seek help?
Okay. See, first and the foremost, Richa madam, see, this is the same technique which we do for suicide management. The people who are suicidal will never go to a psychiatrist. They will become very angry if you tell you go to a psychiatrist. Similarly, Richaji, if you tell your friend, go and seek help, they will not do. First and the foremost, you have to spend time with them and see what is the problem. And can you help them in a way? First and the foremost is giving time to them, maybe virtually also, that is over the phone or maybe video chat, that helps them going on. So for example, for a suicide prevention program, what we do is gatekeeper training program of everyone. So that a person who is suicidal, the person who is going to come to know that he is suicidal is his friend, not anybody else. Even in doctor also. If a doctor becomes suicidal, it may be anesthetist and next is the psychiatrist. Highest rate of suicide. The person who comes to know is my friend. If I'm becoming suicidal, I will give some, without my knowledge, I'll give him some signals. So they have to pick it up. So if they are able, if they have undergone training, they know how to talk to them, spending time. That is the reason WHO in the previous 2017-18, they said, let's talk. Let's talk, because the only way the frustrated emotion comes out is by discussing, talking, expressing our emotion. See, that is the reason, even one of the things nowadays, the corporate in some places, they go and they express their emotion by hitting things. That is maybe one way. Hitting the, what we call it as objects, okay, or displacing anger. The best way is discussing, talking. So women does this by discussion. You may call it as gossiping. That is the only healthy way of doing it. That is the reason women has a longer life than the men, because men don't express. So here, if you think that they are stressed out, talk to them daily, morning once, evening once, give that time, 5 minutes. Talk to them. How are you? What's happening? Any help is required? Hey, come, we'll have a coffee together. That will help them. And if you think they're making some, what we call it as suicidal plans by chance, if they are doing it, talk to their family members, discuss them. You have to break confidentiality at that time when their life is at danger. So this suicide prevention program, September 10th is the suicide prevention day. We are starting from our team, what we call it as suicide gatekeeper training program for all schools, colleges, just like physical first aid, psychological first aid. Everybody should know, if they think that somebody is going through a stress, sitting with them, spending 5 to 10 minutes, he will postpone his suicidal ideas. That means we are postponing his death. You are given a first aid. So that first aid is what everybody should learn, and giving time, because everybody's lifetime is limited. You are giving part of his time for he or she. So that means that person feels that somebody is valuing my time. Even the best of the best doctors, you ask them, they have given their time, and the person postponed their suicidal ideas. So they are alive now. So suicide is not just for killing themselves. It is a cry for help, actually. So similarly here, your friend requests not only help is he or she is talking to you. That is very important. Now you are the main source of what we call it as providing support. You may get burnt out. You take help from somebody else to support that person. Find who are the other people can support them. So that is the best way to go around. So, and also bringing he or her family members to support also will help. Yes.
Sure, thank you so much, Dr. Suresh.
Yeah. Yes, Vinay, over to you.
Yes.
Hello.
I think Dr. Vijay Kumar would like to ask a question. I'm unmuting.
Sir.
Please go ahead.
Hello, sir.
Yes, Vijay Kumar, go ahead.
Is it possible to send the message from the demand or to the government or to bureaucrats or to the government from demand that healthcare workers are under much stress because they have not been to their houses since 6 months, and there is a less HR status in the hospital or in field work.
Okay, Vijay Kumar Balegar, if I remember you, you are a part of district mental health program of Haveri. Yes, Vijay Kumar?
Yes, sir. Yeah.
Yeah, Vijay Kumar Balegar. Yes, we are making all efforts to discuss with the various administrators. We had a meeting and we are in a continuous discussion with the administration. So we are making our efforts, and even Professor B.N. Gangadhar, the director of NIMANS, who is from MCI, Ethics Committee Chairperson, we are also having discussion. Even today we had a meeting actually. We are updating them. And yes, of course, there will be a tussle between various groups. And I know this question came on the background of certain things. We are making our efforts. Healthcare workers are under tremendous stress. See, I'm not telling that this class is going to change the stress management. No, this is the first step for a long journey to have stress-free life. So it's a process, not a one stress management class will change everything. No, nobody will change in the first class. It is a process. So yes, of course, that is the reason I told you, no, in a stress management, one is myself, next one is the hospital, another one is the community. We are doing our advocacy from NIMANS to the various health administrators, including the health secretary, including the health ministers. We are in constant touch. We are giving the information. They also are aware of it. They are also trying to balance between the healthcare worker stress and also providing care. So there is what we call it as balancing has to be done. Advocacy is definitely going on, Mr. Vijay Kumar Baligar. Yes, over to you.
Thank you so much.
Since 15 days.
Yes,
since 15 days, I am COVID positive.
COVID positive.
15 days, I am in home isolation.
Yeah. Yes, Vijay Kumar, how are you?
Home isolation.
How are you dealing the stress
I'm
of,
fine.
okay, how did you deal with your family
Okay,
members?
I'm fine.
You're fine. Okay, good.
Yeah, still, my son is also came positive.
Okay, how is he
Still,
doing?
I am
Right?
counseling the patients who are COVID positive. Still, I am counseling from a home.
Excellent, Vijay. That is what is all about. Life is, in spite of we are suffering, we are helping. That gives the meaning for our life. You think back when you joined MBBS. Ask Dr. Vijay Kumar when he joined first year MBBS what he wanted to do. The what you are doing, that is the same Vijay Kumar in the first MBBS. Unfortunately, over a period of second MBBS, third MBBS, when we do PG, we start protecting your professions, not our patients. So I'm looking at a Vijay Kumar who has joined first MBBS. He had a vision of serving people even if he is suffering. Excellent, Vijay Kumar. We are proud of you.
Thank you. Thank you very much.
Thank you. We have Kaladhar who would like to ask you a question, Dr. Suresh. Please go ahead, Kaladhar.
Hello, Dr. Suresh. That was a nice session. And I just had one question. So what is the piece of advice that you would like to give to the hospital management in particular, to help in dealing, with this pandemic time to the healthcare workers? Because yes, the hospital has to run infrastructure-wise, everything. I mean, everything has to be up and running to take care of all the patients who are suffering. But then again, any specific piece of advice you'd like to give to the hospital management to help these healthcare workers in particular?
Three important things, sir. Communication, communication, communication. See, as a health, because I'm giving you from my own experience, maybe wrong. See, I am being head of telemedicine center, running the telemedicine center, and in the pandemic, it has become very active. I'm in charge of one adult unit. I'm in charge of forensic psychiatry unit. So and also other beds I'm running. I have around 15 to 20 people working under me. Every day evening, I have a Zoom meeting with all my team members. Everybody is given opportunity to speak and asking, how was your day? So you have to, suppose, Reddy ji, if you have a big team, you divide the team into maybe around 6 or 7. Every 6, 7 will run a virtual meeting, maybe around 5, maybe half an hour, asking how they are doing. And each team will learn from other people how to deal the stress. That open communication, and then if you are the chief of that institute, you should be standing front and leading, giving time to every person. If they have a problem, your door should be open to discussion. That is very essential. Today, if I have anything to discuss, my director, Professor B.N. Gangadhar, will directly open his room. I can go to his house, even in the middle of the night, I can call him. He says, Suresh, I'll call you back in 2 minutes. He calls back. That is the leadership. Like Professor B.N. Gangadhar, the director of NIMHANS, he gives me complete freedom to talk, discuss. And sometimes if I do a protocol violation in doing work, he completely forgive me and he says, you have done the best. That proactive leadership, delegation of work, trusting your colleagues, having communication open, that leads a wonderful working environment, sir. If the communication is not there, I'm telling you, stress will be at the top notch. If the communication is good, things will ease out because everybody thinks I am stressed out. The discussion starts opening. Every team, the big team makes it smaller teams and everybody start discussing. At the end of the day, the things will start moving. Because the person who is coping well, he has many friends. He knows that he has stress, he will talk to everybody. The person who doesn't have that skill will become more and more internalizing and he will not discuss, and he'll be the one either will do something wrong or else because of his stress, he will do mistakes which will have an impact on the healthcare industry because vicarious liability of his problem will come on the administration. Mm-hmm. Third, that is the reason you have to make sure the communication is open, sir. Communication is the key. Communication. So all team members, you have to make sure that your next level down should not be shouting at people. You should be more engaging, not only to the clients or the patients, to the staff, because if your staff is good, they can provide care. If the staff is completely stressed out, your people are shouting at them, sorry to say that, they will shout back, it will become a problem. So it is how well you deal the whole scenario makes a difference, sir. So the communication is the only answer, if you ask me.
Thank you. Thanks for that, Doctor. Thank you.
Okay, sir.
The last question for this session, Anjali would like to ask a question. Anjali, please go ahead. I think she might be having a broadband issue.
Okay.
And sir, I think one question, I think we don't have any more questions right now. What's your take on this? Is this something which is going to be like any other flu and going to be with us for the rest of our life? Or is it something which is going to get eradicated finally?
See, it's the Indian population is 136 crore. This pandemic is a big challenge, definitely. It's going to be with us for a long time, maybe another 6 months, 1 year. We don't know. If this strain after 6 months or 1 year down the line, we are able to get immunity, fine. If there is a change in the strain, if there is a mutation, then again, we will have a different set of infection again. Or a person who has got infected, and if it is going to be for 1 year, it can become endemic also. But anyhow, the good news is there is a reinfection, but the reinfection, there is a recently, I think 2 days back, there was a report which came from, I think from UK or Singapore, I believe. Reinfection was there and the antibody response was very fast. The person recovered very fast. So that's a good news, but it was only after 4.5 months the reinfection occurred and recovered. The illness was very mild. But if it occurs after 8 months, whether the same response occurs, we don't know. So we are still in the early part of understanding the pandemic. So the good news is the whole world is in a race to find the vaccine. It's an excellent news. First time, many journals have given free of access to the science, and every science findings, there is a criticism and there is what we call it as debate is going on. And that is the beauty of our science now, especially in medical science. One person says this is good, but there is a negative thing, the criticism occurs, and there is evolving. Science evolves, it is not static. So we don't know the answer at this point of time, how it is going to be over a period of time, but definitely considering our population, and if there is no mutation in the virus, yes, it may go away, but otherwise if there is a mutation is occurring, then we may find new strain of infection occurring every year.
Sure. With that, I think we'll be able to conclude our session. I know there are certain answers we are still looking for, and we look forward for many more such valuable sessions from you, Dr. Suresh. On behalf of IPC Health and Impulses, I would like to thank you so much for spending about close to 2 hours educating each one of us. Thank you once again, and we would end this webinar now. Thank you.
Stay safe.